Hi guys, welcome back to my channel. This is MedMade Simply Easy. In this video, we're going to see about measles. Epidemiology. Measles is a common and serious childhood exanthematous illness. It contributes to 1% of deaths in children less than 5 years old, and India contributes to 25% of global measles burden. It is common in developing countries due to malnutrition and vitamin A deficiency, which causes impaired cell-mediated immunity. The incidence of measles has decreased due to immunization. Etiopathogenesis. The causative organism is an RNA virus which belongs to paramyxovirus family. It is transmitted by droplet nuclei from nasal and throat secretions. The period of infectivity is 4 days before and 5 days after rash. The virus multiplies in respiratory epithelium, which causes primary viremia, which causes an infection of the reticuloendothelial system, which leads to a secondary viremia and then which causes the systemic symptoms. The incubation period of measles is 10 days. Clinical features: fever, cough, runny nose, malaise, coplic spots, and maculopapular rash are the clinical features of measles. Maculopapular rash appear after 3 days of fever and subside over 7 days. So it begins on the forehead, behind the ears, upper neck, and then spreads to the extremities. So if you see in this picture, this is an example of maculopapular rash. Coplic spots are pathognomic feature of measles. It is a discrete red lesion with bluish white spots in the center, and it is present on the buccal mucosa. It is present on the inner aspects of cheek and may spread to lips and hard palate. So if you see in this picture, you can see red lesions with white spots in the center. And measles are also associated with conjunctivitis and cough bouts. Measles vaccines are effective in prevention of measles if given within 72 hours of exposure. Measles is a self-limiting disease and doesn't have a specific treatment. Since vitamin A deficiency is a risk factor for measles, measles patients are supplemented with vitamin A for 2 days. The dosage are 2 lakh international units are given if the child is more than 1 year. 1 lakh international units of vitamin A is given if the child is between 6 months to 1 year, and 50,000 international units is given if the child is below 6 months. And an antiviral drug called ribavirin is given for immunocompromised patients. Complications of measles. In RS, measles can cause activation of latent tuberculosis, and it can also cause bacterial pneumonia, croup, tracheitis, and bronchiolitis. In CNS, it can cause febrile convulsions, encephalitis, and SSPE, which is a long-term complication. It is subacute sclerosing panencephalitis. The direct complications of measles are black measles, the hemorrhagic form, and it predisposes to otitis media, cellulitis, diarrhea, and dysentery. It can also lead to severe acute malnutrition or SAM, and it can also lead to vitamin A deficiency. The other complications of measles are hepatitis, appendicitis, corneal ulceration, and myocarditis. Encephalitis. 1 in 5,000 cases of measles develop encephalitis. It usually develops 8 days after the onset of illness, and the symptoms are headache, lethargy, irritability, and which later progresses to convulsions and coma. The long-term complications of encephalitis are deafness, seizures, hemiplegia, and learning difficulties. SSPE. It is a rare and devastating illness, and it is seen in 1 lakh cases. And there is usually a history of primary measles infection before 2 years. So it persists in the central nervous system, which causes a loss of neurological function, which ultimately leads to dementia and death. So in investigations, the high levels of measles antibody is seen in blood and cerebrospinal fluid, and the EEG and characteristic EEG abnormalities are also seen. Thank you. Subscribe for more videos and check the Pediatrics playlist for other videos. And let me know your suggestions in the comment box below.